Okay guys, so we're here to make a change and to save babies' lives. Well, and everybody's life that receives heparin.
Mostly babies.
Yeah, so make sure you really focus a lot on the fishbone diagram. I know you can do it.
You have a lot of background on evidence-based practice.
Mm-hmm. Alright.
Hello.
Hello.
Oh,
My name's
okay.
Sam.
Joe?
Sam. Jessica.
Kelly.
Joe?
Haley. Nice to meet you. Haley.
Kelly.
Haley. Nice to meet you guys.
Haley, now I want to welcome you to JCO. We're very interested to hear what you have to say for us today.
Thank you.
So can one of you start off by telling us what brings you here today?
Yeah, so I'll start by giving a brief introduction about the situation. So, Mr. and Mrs. Quaid's twin babies had developed a staph infection just days after coming home from being born. So their doctors had recommended bringing the newborns to Cedars-Sinai Medical Center where they could receive IV antibiotics to treat that staph infection. It appears as if they were doing really well after their second day of being in the hospital. So the Quaids felt some relief and decided to go home and rest for a little bit. However, while they were at home, the nurse caring for the twins had accidentally given them 2 adult doses of the blood thinner heparin. A safe dose of heparin for a newborn is about 10 units. However, they were given 10,000 units. That is 10,000 times a dose that the babies were supposed to receive. When the Quaids had arrived to the hospital the next morning, the babies were literally bleeding out of every orifice possible, and their blood had turned to basically the consistency of water. There was a series of errors that had led to the overdose that left these babies literally fighting for their lives. First of all, a pharmacy technician had made a mistake by putting the larger dose bottle of heparin in the same bin with the smaller dose bottles on the unit. And both of these doses on the bottles have very similar labels, so without looking at the label, you could easily misinterpret which one you're giving. So secondly, the nurse that was caring for the Quaid babies did grab the wrong bottle, and she did not read the label, which led to this problem. And this is not the first time that something like this has happened. A very similar incident actually killed 3 babies in Indianapolis a year before the Quaid's twins situation. So this is something that we're very passionate about that we feel needs to be changed and looked at.
Okay, so what type of practice are you guys planning to implement?
Well, we really want to focus on evidence-based practice, which, as you guys know, it's a problem-solving approach to practice that involves the conscious use of current best evidence in making decisions about patient care. So this is going to consist of a systematic search for the most relevant evidence, critical appraisal of evidence to answer a clinical question, and it's going to consider the clinician's expertise and the patient's values and preferences, which is the most important. It's important that we adhere to policies and procedures for the best practice available in an effort to prevent errors such as with the Quaid twins and the dosage, provide opportunities for nursing care to be more individualized, more effective, streamlined, and dynamic. It's going to maximize effects of clinical judgment. It's going to help stay current with the latest technological advances and take advantage of new knowledge developments. And it's going to maximize patient-effective care. So what's considered evidence would be research findings, knowledge from basic science, clinical knowledge, and expert opinion. And as healthcare professionals and as nurses, I feel that any care that we deliver should have a rationale to back up anything that we carry out. I feel that as a nurse, we are expected to understand why we're caring for patients, whereby a rationale is provided for the care that we provide, and evidence-based practice is going to help us stay updated with policies and procedures. So it's fundamental that we keep our skills and knowledge current, which is going to enable us to provide effective care as well as safe care for our patients.
I wanted to give you guys a couple worksheets that we have been working on.
Thank you. So we see a fishbone diagram.
I'll be
Can you
presenting
explain
you the
that?
larger fishbone diagram. So we have some causes here of what we believe were the problems and then kind of lead towards the effect in a minute. One of the first is the 5 rights of medication administration. It's kind of the foundation of giving medication, and these were clearly not followed because at the end of the day, the very wrong dose was given to the Quaid twins. Next is the second RN check for the heparin administration. While this may or may not have been done, the second RN didn't realize that this was the wrong dose. We want to kind of instill that attitude of don't just look at it and just say, okay, because you've worked with them forever. Actually take the time and check it, make sure it's the right medication. Now, we were sure of the organizational system, if things were a little crazy on the unit or things were not very clean back where the medications were that could cause a problem, so we're looking into that. Then the human error of drawing up the heparin, which kind of goes back to the 5 rights of medication administration. So the nurse had to look at, we would hope the nurse would look at the medication, realize this is 1,000 times higher than it needed to be, call the pharmacy and get the right one, but that was not done. And again, failure of the crucial check to the 5 rights of medications. And we had the misread label. I understand these vials look very similar, but we're still expecting people to look at the labels, ensuring that they're giving the safe medication to their patients. And failure to document the medication error. I don't know if this was done maliciously or just because they didn't realize an error was done at first. So this kind of led to more errors throughout the day and throughout the following days. So we got to make sure that people are up to date if they do realize there was a medication error. And mixing pediatric and adult vials. The 10 vial and the 10,000 vials should not be near each other, in my opinion. And then we're questioning the nurse-to-patient ratio. Were there too many patients per nurses, and did this affect the overall care? Was the nurse not able to realize that something was going on with these kids, the Quaid twins, early enough? And we're also looking into the hours worked by the nurse to see if they've worked too many hours, if they're excessively tired, fatigued, all that, or not. Some more causes we have related to staffing, going back to the nurse-patient ratio, the hours worked. Was there the same nurse for the twins? Which I assume so, because they kept getting the wrong medication. How sick were these patients originally? It sounded like they were getting better. So I don't think they would really be in there all the time looking at them until they realized something was wrong. And were there floating nurses? And should the float nurse be taking care of these very acutely ill patients where they need to know what's going on with the unit, not to disparage the float nurse, but we want to make sure that patients are getting adequate care. Maybe put them with the less sick. Some procedures. How to identify patients, we go back to the wristband, the 2 patient identifiers, was that done? And the procedure of pulling medications. What I understand, the medications were in the same bin, and it was just kind of pulled out. And they didn't realize because they look so similar. So the 5 rights of medication administration were not followed, and we don't know if there was a double check by the RN, or if the RN who did do the double check was not very good with it. We'd like to talk about some equipment changes, the pre-filled syringe. Well, the pre-filled syringe isn't going to solve the problem of putting the wrong pre-filled syringe into the unit, into the bin. But if it comes to drawing up certain medications that can be very harmful in specific dosages, the pre-filled syringe would be very beneficial to ensuring that the right medications are being given. And technological advances on the unit. I'd like to talk to you a little bit about online recording, online charting, because there's a lot of checks and balances in place that would prevent this from happening. We also want to ensure that the medication errors are reported, and the pharmacy versus the nurse, and I guess here say one was wrong over the other because they're both errors made on both sides. Better labels, the 10,000 and the 10 vial look very similar, and this is kind of dangerous, so we're going to switch that up, and the 2 RN checks again. This is our fishbone diagram.
Okay, I think, well, I agree, and I think you would agree that your fishbone is really strong and your cause and effects are really appropriate for this case. But what we have to question is how is evidence-based practice going to benefit heparin administration in this case?
Okay, well, if you look at your worksheet right there, we have the PDSA, excuse me. And in order to know what a hospital's doing wrong, or census has happened in other places, countrywide, in hospitals, what is being problematic, we need to investigate what's going on. And we're using the PDSA model to do so. The PDSA model represents plan, do, study, and act. And it separates each section so you can figure out the problem in a logical way. So before you begin that, you have to get a little bit of background. So how did we get to this point and what's going wrong? Clearly, they're not getting the right medication. They're labeled very similar. There's errors on all different ends, pharmacy, nurses, etc. Is it a hospital problem? Yes, it is a hospital problem, but it also is nationwide hospital problems because of the cases in Indianapolis as well. And a medication problem, yes, the doses, the color, they're very similar. They shouldn't be in the same place if they are so similar looking. So we begin the PDSA with the plan. With a plan, we research causative agents of incident and create a change to prevent it from happening, again, using evidence-based practice. So in order to do that, we do a who, what, where, when, how. So the who are we trying to help? The patients who are receiving heparin. In this case, it's the Quaid twins, but in other cases, in general, any other child or any adult that's getting heparin in the wrong dosage. What do we want to change? We want to give accurate heparin administration, so we need to revise the system to do so. When would we like this to be done? As soon as possible. We don't need this happening anymore. And where? Everywhere that's able to give heparin. And how are we going to do that? We want to change the vials of heparin so they look different. We want to train nurses on better medication administration and maybe organize the hospital settings in some ways where we can avoid these problems. So the next step would be the do. So this is when you carry out the change. This is when we would be talking to the pharmacy, making sure they have a plan, changing the heparin vial colors, putting them in different areas if they need to be on the same unit, and teaching these nurses that this is just something that shouldn't be happening. The next step is study, and according to the article, evidence-based practice, clinical simulation workshops, and intravenous medication moving towards safer practice. This was done in 2005, and it discussed the problems with medication administration, doses calculations, and safe medication administration in general. Ironically, in 2005, 73% of the medication problems were with anticoagulants, so that fits perfectly with the situation that we're in right now. So within multiple facilities, in order to figure out this problem, they found multiple statistics about problems within the hospital, and through that they made clinical simulations in order to educate the nurses on how to give better medication administration. Some of these nurses were so elderly or just so advanced that they didn't even know the 6 rights medication that we learned. They learned it completely different. So in order to keep them up to date, we needed to educate them through these simulations on how to give medication. And 46% of the nurses went through these simulations, and every single one of them preferred this type of learning. And they felt that the hands-on experience was beneficial, and they all benefited from being there. So that's an example of how this was used in multiple hospitals. And the last step is acting. What have we learned? We have learned that evidence-based practice is helping people. It's helping people to give the right medications. We're teaching nurses better care, because if you went to nursing school 30 years ago, it's going to be a lot different than it is now, so you need to keep up to date with these things. And so risk reduction strategies that we've learned, the 6 rights medication obviously, double checking of the heparin with another nurse, checking it again and again and again, just being aware of what you're doing, and having heparin vials labeled more strictly if they need to be on the same unit, putting them in different drawers, making papers on the walls, putting them on your doors to warning, these look alike if you can't do anything else. So these are just small things that can make a big difference.
Okay, good. I think you guys have a lot of valid points. So what is the process you guys plan to use to implement this into the evidence-based practice?
Well, there's 5 key steps in the evidence-based practice process, which is going to include, first and foremost, formulation of a clinical question. In this case, how can we further prevent medication errors, such as in the Quaid twin situation? Second, we're going to gather the best evidence to answer the clinical question. You're going to seek critical appraisal of the best evidence. Then you're going to integrate the evidence with the clinician's own expertise, assessment of the patient's condition, available healthcare resources, and the patient's preferences and values to be implemented in the clinical decision. And then lastly, you're going to evaluate the practice change as a result of implementing the evidence. And while all 5 steps are critical, the 5th step is one of the most neglected. It's not uncommon for healthcare providers to implement a practice change based on evidence, but fail to evaluate the effectiveness of the change. So evaluation of the practice change is really important, and it's imperative that nurses and other healthcare professionals know how a particular treatment worked or the effectiveness of the clinical decisions. So to effectively apply evidence-based practice process, in addition to basic skills required to undertake nursing work, a nurse must have the ability to identify knowledge gaps, formulate relevant questions, conduct an efficient literature search, apply rules of evidence to determine the validity of studies, apply the literature findings appropriately to the patient's problem, and appropriately involve the patient in the clinical decision making. So it's important for nurses to be involved in evidence-based practice because we are the direct caregivers. We see patients the most, we spend the most time with them, so we are first and foremost seeing what works and what doesn't work, so we are the ones who need to be educated on how we can further educate and other healthcare professionals as to what works and what doesn't work to prevent further compromising in patient safety.
Good. Well, if you agree, I think we really like your presentation. We think you have some really strong points in implementing a really positive practice into nursing. So Haley and I will take it to the upper board members and we will be in contact with you. Thank you for coming in.
Thank
you.